What's up, you guys? This is Boy Miguel giving you your daily dose of radiation. Today's video will cover X-ray tech uniforms, or scrubs as you call it. So, as anyone else who works in the hospital or any medical field will know, you have to wear scrubs. So, depending on where you work, your hospital will vary on your scrubs. I've seen certain techs wear black, certain techs wear purple, certain techs wear green. And where I work, we work with royal blue. That is the X-ray. The whole radiology department is in those scrubs. Certain hospitals, each like department of radiology wears different scrubs. Some of them is like you can wear whatever you want. Night shift is kind of weird because like sometimes you can kind of get away with not wearing those because upper management ain't there, but usually they'll want you to stay in uniform. Now, like I'll show you because I have some right here. Okay. So this is my basic standard uniform. So depending on what you do at work, pockets here or like down here are kind of optional, I would say, because depending on if you're in the main, if you're in the ER, or if you're at night, will vary the usability of certain stuff. So let me give you an example so you can understand. Okay, let me get some equipment right here. Okay, so if you work in the main radiology department, do a lot of fluoroscopy, do a lot of notes, do a lot of like charting type stuff, do a lot of consents, do forms. If you have a pen, it'd be useful to have a little pocket right here to have your markers, to have the thing you need. It can come handy. Yes, I know you're like, Miguel, you can just put it in your pocket, but sometimes this is easier. Like that's something, just a little thing, make your job easier, alright? Let's say you're in the ER, right? Most of the time you really don't need pockets. Like maybe just like put your phone or like put some gloves in your little like pockets, but they're like in your pants. So you don't really need to have a pocket up here because like, I mean, you'll have this and you have your little like little badge and stuff. I mean, it does come handy to have here because usually like you can either have your markers stuck on your little badge or you can have them in your little pocket. So that one can vary. But night shift, if you work at a hospital, it would benefit you to have multiple pockets on your scrub top. Like on your shirt, have like two at the, like in the bottom and one up here. So this is why. If you do morning ports like I do and you have to shoot, let's say 30, 40, 50, whatever ungodly amount of morning ports you got to do, it's easier and faster if you just in your own department grab a bunch of gloves and just like stack them up and already have them in your pocket. Instead of each patient going, finding gloves, grab it, put them on, you can already have the whole shebang going. So one I like is was it Healing Works? It's like a little tree with like the two little things. They have like triple pocket, has one up here and then two in the bottom. Those come handy to me. Those have like good amount like room inside to keep gloves. So that would be something that could be useful. And then there's like also in your pants, I like to have like the regular, like the little pockets on your waist, and then like the lower above your knee on the side pockets. Those come in handy sometimes, especially if I know I'm going to be doing a lot of patients, to have extra gloves and extra stuff like that. I know nursing is a completely different world because the amount of stuff they have to carry and the pocket game and their whole situation will be different. But yeah, hope this gives you a little useful information of tips and tricks, and see you on the next one.